Well, what we have here today is the Invacare Reliant 450 patient lift. You'll hear these referred to sometimes as a Hoyer lift. This is actually made by Invacare, not Hoyer. And we're going to do a demonstration today on a few key components of this electric lift. This has a 24-volt battery and an electric motor which operates the boom, which raises and lowers. First few things that we want to discuss today are the safety of the lift. First one being, most lifts, and in this case, are equipped with locking wheels. The purpose of the wheel locks is to place them in place only when attaching the sling, which should always be inspected prior to every use. You'll see the different hangers on the different hooks on the hanger here, which are designed for four strap slings. You would put one on each side. If you have a 6-sling strap, you would put this 5th and 6th one on the center for stability. Once the sling has been attached, the most important step is to make sure that the wheels are unlocked prior to lifting the patient. And there's a lot of misconception about that, and the purpose for having the wheels unlocked, when you're lifting a patient off of a surface, the lift itself needs to equalize with the patient's weight, and it needs to stabilize. If the wheels were in the locked position, you could put the patient at risk. The next safety feature, which is something that all lifts should have, and this one is in a manual function, is the legs open. The legs should also always be in an open position when lifting the patient. This provides for greater stability at the base. However, when you're navigating the lift through tight quarters such as a doorway, or if you're trying to navigate the legs under or around some furniture, you can bring them inside, but the lift should always be opened up when lifting the patient. Another safety feature on this lift is if anything were to go wrong while lifting an individual, now you'll see the controller, I'm in the up position, and you needed to do an emergency stop. The red button, if you were to press this in, is an emergency stop feature, and that's important to note. However, obviously the first thing you would do if you needed to stop was to take your hand off of this, but let's say this got in the wrong hands or this was pressed up against something and you needed to hurry and shut it off, you would use this red button. Another safety feature, should the lift itself mechanically fail and you have the patient lifted in the upright position and you needed to lower them and the motor is for some reason, and this should never happen, but if it were to fail in the upright position, there's 2 ways that you can get the lift to lower. One, you'll see the emergency button, emergency name right below the red button. The first primary way to lower the lift would be to press a pin right into that hole. If you don't have a pin handy, the secondary way would be to pull up on this red lever, and with a patient's weight in the lift, this lift will start to lower itself. Those are the primary safety things. The brakes, again, we talked about not using the brakes when lifting the subject. We've talked about always having the base open. We've discussed the safety button, which can be pressed in if you needed to stop the lift for any reason. We've also discussed the primary and the secondary point to which to lower the lift if the motor were to fail. For any other safety features, refer to Invacare.com. Thank you.